Dear students, I am making this video especially for the students. And recently we had an exam, and as we all know that now the exam is scenario based. That is, it is not like you give a disease and ask about its signs and symptoms. In this video, I will try to make it short, and at the same time, I will also try that I may be able to give you the required information and the exact method, near to exact, that how to attempt the scenario based SAQs and SEQs in ophthalmology. So, first of all, don't be panic when you get the paper. Take your time. Scenarios are made in a way in which there are one or more than one key points are definitely there which direct you towards the right diagnosis and further answers to that scenario which are being asked. Here I would also like to uh, clarify that many students, most of the students rather, think that if after reading the scenario their diagnosis is wrong, then the further things which they will write, they will also not get the numbers. It's not true, because if the diagnosis is wrong, but the questions, the next questions, if you have that your diagnosis was wrong, you will be given the marks of that number. Or if, and I feel that the numbers of other stems are given. Now I give you examples of a couple of scenarios here. For example, if in this video if I give examples of more scenarios, then there will be this video will become so long and people will become less interested. I hope, if Allah's will, in future I will also be posting more scenarios. In this video I will discuss only two scenarios which are alike, but the diagnosis and further management is totally different. One is of cataract and the other is about glaucoma. Now, if a scenario, when we make the scenario, the examiners, what we think, now I am going to make the scenario about glaucoma, primary open angle glaucoma. Then I will give a single or more than single clues, and only you can attempt the scenario if you have a conceptual knowledge of ophthalmology. So I may, sorry for my throat. So my stereo may be like sound like this. A 60-year-old man presents in eye ward or IOPD with complaints of occasional halos in front of the eyes, and on examination his vision was 6 by 6 in both eyes. Intraocular pressure was 28 mm of mercury. As I was sitting in a tertiary hospital, the other required tests could not be performed. What is the diagnosis? What is the probable diagnosis? What are the medical treatment options and what are the surgical treatment options? Now, you see, in this scenario, I have given you a, a, an imaginary uh, line in which you have found that nothing is abnormal, but I have given you two clues, and only the person who has red glaucoma and cataract and other eye diseases also will be able to answer correctly. One clue which I gave you is halos around the around the light. Yeah, halos while looking. Now, halos, primary open angle glaucoma is mostly symptomless, and we also call it silent killer because it does not have any symptoms. That's why patients come to us very late, and when they come, they have lost most of their peripheral vision. As you know, the in glaucoma, the vision is lost in the periphery. That is, visual fields are affected. So his central vision will be okay, and he could be 6/6. Besides the fact that he has lost his most of the optic nerve and he very close to optic atrophy, but because the central fibers are intact, so he can still see clearly. And halos means that because of raised intraocular pressure, when it is above 21 mm of mercury, it may cause retention of water in corneal layers. Cornea has got 5 layers, and because of this retention of water, the light which comes into the, you will see a halo around the bulb. Similarly, around other objects, because of water retention, the clarity will be gone. Cornea should be transparent. This is one of the clues. The second clue, students often says that you did not tell us about that the visual fields are defected. Optic disc cupping is there. Sorry, the light is gone. May someone on the light of the UPS, please? Please on the light. Thank you. I'm sorry for that. Uh, ok- uh, if we would have told, if we would have tell you about that the wheel fields are gone, there is optic disc cupping, then the diagnosis is very clear. We have given you one very clear clue and one relatively uh, clear view. The most clear view is that the intraocular pressure is more than 21. It is 26 mm of mercury in both eyes. And if someone has read the glaucoma or has concept of glaucoma, he must be knowing that the glaucoma has triad in which there is one raised intraocular pressure, number one. There are typical visual field effects, number two, and there is optic disc cupping, number three. So any one of these three factors can be given as a clue towards the diagnosis. So when you have made the diagnosis of primary open angle glaucoma, now what about the medical treatment and surgical treatment is just a matter of theoretical knowledge. If you have what is written in the book, you can write that straight away. But to reach to the diagnosis, you have to do a very clear cut and logical uh, brainstorming. Why it can't be cataract? let's talk about it. Why it cannot be cataract? In cataract, intraocular pressure is not raised. Vision is not 6 by 6. The most common complaint of the patients of cataract is that they cannot see from far. But you see that in this scenario, the vision from the far is 6 by 6. It cannot be cataract. Why it cannot be latent glaucoma or chronic glaucoma? Some students ask me, why can't? So, we cannot label, we did not mention anything about gonioscopy until there is any sort of mentioning of angle or the word of gonioscopy is used. You cannot jump to closed angle glaucoma, and until we have performed the gonioscopy we cannot write that it is primary open angle glaucoma because we have not seen the angle that it is open. But as I told you in the scenario, I told you that the doctor or myself was sitting at a place where other tests could not be performed because of the lack of facilities. So based on these facts and figures, you have the one very important clue, that is raised intraocular pressure. So there is no mentioning of sudden rise of intraocular pressure and sudden loss of vision, vomiting, nausea, and blurred vision or other signs which should direct you towards angle closure or congestive glaucoma. So this is something which I feel will clarify most of your questions and will help you in attempting questions. I will try, if Allah wills, that in coming days I will make more videos on different scenarios and how to attempt and how to find out the hidden uh, clues in that scenarios. Here I would stop. If any student or anyone has any sort of question, without any hesitation, please write in the comment box what you want to hear, what you want to learn. I would try my level best to answer to your queries and questions. I would stop here. The video is already almost about 15 minutes. So thank you very much for watching. For now, thank you very much. Allah Hafiz.